For nearly a decade, Dr. LaQuandra Nesbitt has carried the weight of this city's health on her shoulders. The district's doctor says she sought to treat the citizens here like the patients she once saw one-on-one. Nesbitt steps down as health director next week. So we sat down to talk about her time in office during D.C.'s most pressing public health crisis.
So this was the war room.
Yes, not only was this the room where it happened for DC Health, this was the room where it happened for a lot of DC government.
City leaders flocked here when something called coronavirus became part of our daily lives. In this space, the crucial and life-saving messages about how all of us would have to change were shaped and shared.
I'm sitting at the table and everyone turns to look at me and say, what do we do? What is it we should expect?
Today we are establishing emergency rules that calls for a ban on all mass gatherings.
Nesbitt had already dealt with Ebola, H1N1, and Zika in her many years of public health. She knew the playbook.
Thank you, Madam Mayor.
But after months of following her own advice, she could feel the weight of those decisions.
We would have all these discussions about don't travel, right? And a lot of my family isn't here. And that first Thanksgiving was really tough. And I absolutely sat on my couch and cried.
She knew that actions had consequences, but she also knew she couldn't pull this city through an unprecedented crisis alone.
Did we do our part, though, as citizens?
People expressed their gratitude for my leadership during that time, and I am very quick to say back to them, thank you. And I am extremely grateful to the district residents for doing their part.
Vaccines played a crucial role. Setting up those centers across the city was no easy task.
We would often get approval of a vaccine. Sometimes that happened on a Sunday, and then these large shipments of vaccines that will be coming within 24 hours. And you're thinking about equity from the perspective of who's going to be most at risk of going into the hospital if they don't get these doses of vaccine.
Long before COVID, Nesbitt set out to address the district's disparity gaps. She set up an Office of Health Equity to improve outcomes in communities of color.
That I'm extraordinarily proud of, where you look at where the city has come in the last 5 to 7 years in terms of our HIV outcomes, in terms of our infant mortality outcomes. We have the lowest infant mortality rate that this city has ever experienced, including among Black babies. I wish you the best on your future endeavors and thank you for keeping us safe all these years.
How does it feel to read that?
You know, it's very heartwarming, to say the least.
Nesbitt has made a career out of staying cool under pressure.
I just
Gotta get out of here.
Though most don't know that her office stays at about 80 degrees, even during hot summer days.
They're kind of cryptic.
And she's taken lots of handwritten notes to capture this moment in our collective history.
The pandemic ones are at home under lock and key for maybe a book.
She is leaving as another emerging disease is starting to leave a mark in the city, monkeypox.
We've already stood up clinics for this. We've already gotten people pre-registered for appointments. We've already administered over 1,000 doses of vaccine.
It's been a grueling couple of years for this public servant and family physician, so I had to ask the one question on everyone's mind.
Are you burned out too, Dr. Nesbitt?
I'm not leaving because I'm burned out. I just really am at a point in my professional journey where I think I'm ready to serve the community and serve a population in a very different way.
And Dr. Nesbitt tells me she hopes she can stay here in D.C. to do that. In the meantime, she's looking forward to some downtime, and she says the first thing she plans to do after leaving office is head to spend some time with her family with no interruptions after more than 2 very long years.